Just wanted to say thank you for doing this. Well, you're welcome, and thank you for thanking us. So, we've got a whole lot of questions here, and I will do what I can to compile them into categories, and I may do some editing so that the question comes across sort of a compilation of all this being asked, if at all possible. So if it sounds like your question isn't getting asked exactly as you wrote it, that's why. Because otherwise we'll be here tomorrow and we don't have it rented for that long. But what I will be doing is we're going to keep these questions. So when we have our town hall next month at the Senior Center in Post Falls, we can bring them up. So that's an encouragement for you to join us there if your question doesn't get asked today. We're going to do our best, but we've got a lot of people here and they're going to want to be able to respond to these questions, even if the question is directly given to one of the other legislators. Some of our other legislators may choose to comment also, and that is their right and our prerogative. So we will start off with, where to go? I think we've got, oh, and they just keep on coming. Very good. Okay, start off. Can you all hear me? I'd rather not have to use this thing. Okay, good. Thank you. That's what I need. Thumbs up. Very good. All right, so this is a general question. Non-specific is, what steps are going to be taken to rectify the current pain management crisis in Idaho? And Senator D'Souza, since you were jumping in there, I'll give that one to you first. Anybody else who chooses to address it?
Thank you. There's not a really quick answer to that. The task force has met now once a year for 2 years, and we're planning the 3rd meeting in April. It was an impressive group of 47, I believe. I counted around this big U-shaped table when we first met. The meeting lasted for a day and a half. It was more of a conference, and we all started our priorities. There were people from law enforcement and public health districts and pain management doctors and nurses and recovery centers and some recovered addicts who were here, who were there to tell us their story. And there was a set of parents who lost both of their college student sons to drug overdoses on opioids. And these sons went to different colleges, but they were athletes. Each of them were on the football teams for these big colleges. They were injured. They started on pain medication, became addicted, were buying drugs off the street, and ended up overdosing. Sad stories are out there. Not all of this comes from people that start out on the street buying street drugs. There are quite a number of people who are starting out with legitimate prescriptions and then get themselves into trouble. So we have worked with the Board of Pharmacy was there, the Board of Medicine, all of the medical boards. Everyone that you can think of whose work would touch this topic was involved. And there is a plan in place. It is hard to get it implemented quickly because it involves so many steps. But a lot of it starts with education. Educating the patient before they start taking the pills, educating the doctors. There's a phenomenon that many people aren't aware of that's, I can't give you the technical name, but if you are using high amounts of pain medication, especially opioids, it actually increases your sensitivity to pain. So you actually feel more pain. And as they taper you down, even though there's a huge fear factor in tapering off your pain medication, as you taper down, you actually will have less pain. But that's hard to convince patients to do. So some of those actions are going into effect. We have a pharmacy reporting mechanism to help deter people from doctor shopping, going from one doctor and getting medicine and then going to another and another and another around the state or even in the states that we are connected with. So there's no quick answer to that question, but we are working on it and we are very aware
stand up and hopefully talk loud enough. So I also wanted to add, so the Trump administration has made the opioid crisis a pretty significant issue, and they allocated a fairly sizable chunk of funding for the opioid crisis. And I can tell you next week, coming before Joint Finance and Appropriations Committee, which is the budget setting committee for the legislature, there's a supplemental funding mechanism, supplemental funding bill that'll come before us to, and supplemental means it's for the current fiscal year. So as soon as we pass it, that money is available to be used. And it's essentially federal pass-through money for the crisis. And if that does pass Joint Finance and Appropriations and then both bodies, that money will be made available immediately for the Department of Health and Welfare to work on specifically opioid issues in Idaho.
There's a lobbying group going around that's probably talked to every representative here, and every representative product called Kratom. I don't know much about it, but it's something that they're hoping to use for pain management that doesn't have as much of an effect as an opioid. They've got a bill sponsored by Senators Crapo and some other senators on a federal level. So it sounds like it's something serious. Again, I'm not a doctor, I don't stay at a Holiday Inn. But there are some substances out there that may help in the opioid problem, in that it can bring people off of some of these opioids. We just have to wait and see how that goes. Perhaps with Food and Drug, we don't know how it's going to go yet, but it's pretty interesting.
I'm on the Health and Welfare Committee, and we also had a hearing with regard to some of the rules that Senator Souza referenced. And some of the dilemma in our committee was the fact that it doesn't matter what steps we put into place, people are going to find ways around it. We can't stop drugs, including opioids, from being used in our prisons and jails. And so for us to have the notion that we can stop it in public just would be not a wise investment in our time. I think the real issue is, and what I saw was consistent with some of the ideas that were proposed with these rules, is that the ultimate result of the rule that they were suggesting really didn't address the problem. Opioid addiction is a societal problem because it has consequences for all of us, but there are 2 points in the chain that I think are the easiest to target to at least minimize the availability of these substances or abuse. And one, I would say, has more responsibility than others. So that would be with the doctors. And then the second point would be the pharmacies, because there are already mechanisms in place for doctors and pharmacists to check to see when these opioids are being overprescribed, which is a big problem, not just people shopping around trying to find the opioids from doctor shopping, which I guess could be a problem. So if we focus on those 2 points, it's the most realistic opportunity we have to minimize, we cannot eliminate, to minimize the societal effects of opioid addiction and abuse on our state. And this has been kind of an emotional issue. One of the rules that was proposed, which one side believed would help stop the doctor shopping and pharmacy shopping, is to impose a restriction on using cash for Medicaid recipients to buy their prescriptions if there's a controlled substance, any controlled substance, not just opioids. And I think to stigmatize people just for using cash is not a legitimate means to the end that we're seeking. So this is going to continue to be controversial. I think, if we don't change course and focus on the 2 areas where regulation and oversight can do the most good, which is physicians and pharmacies, I think we're going to still be complaining about this 10 years from now, and